Hey everyone, as a reminder, next week is going to be the midterm exam. The format is short answer and essay, and it's going to be available on Sunday as usual on the 17th at noon, but needs to be returned to me using the link in the assignments tab by Friday, October 22nd at 8 o'clock p.m. Eastern Time. More information is of course available for you in the syllabus. Okay, this week we're going to be going over substance abuse treatment, which is one of my very favorite topics. I will admit up front that I'm rather opinionated about these issues, and here's my bias. First of all, as social workers, we are trained that client self-determination is the foundation of our clinical work. And yet, at least when I was doing drug and alcohol treatment, and I don't think it's very much different today, every time I put together a treatment plan for someone, it always started out with abstinence, regardless of what the client wanted. We don't seem to quite get the contradiction that in all other areas we can say, start with where the client is at, and yet when it comes to drug use, we start with what I say goes, and what I say is that you have to abstain. Now, don't get me wrong. For some people, abstinence probably should be their treatment goal, but for many others, there may be different options. In fact, most people who abuse drugs and alcohol resolve those problems with no treatment at all. This is called spontaneous recovery. The most common approach to treatment is called the 12-step model, which is based on acceptance of oneself as an alcoholic and abstinence before any success can be seen in other life areas. I think that's a useful approach, or can be a useful approach at least, but it's easy. And I don't mean to say that the clients are easy, but what you do is easy. Just follow the 12 steps of Alcoholics Anonymous. And when that doesn't work and a client fails, then we blame the client because they just weren't ready to change. I think that we have to be careful using this approach because one size does not fit all, but in my experience, most treatment programs approach it that way. So, okay, enough of my soapbox for now. I'll be interested in hearing about your thoughts about this as well. Don't forget about the exam next week, and get in touch if you've got any questions as you're preparing. We'll talk to you later. Bye-bye.